Hi everyone, I am Dr. Natasha Collia. I am a pediatric emergency medicine physician. I'm a simulation educator and I'm an online parent advocate and educator who currently works at the Hospital for Sick Children. I was definitely honored to be asked to participate in this Q&A, and I look forward to answering all your amazing questions. So let's get started. So I have my questions off to the side here, so I'm gonna look at them and I'm just gonna answer them as best as I can. So let's start with question number 1. What is the best part about your job? That's a great question because my job as a pediatric emergency medicine physician doesn't just really stop right there. I get to work in the emergency department. I get to educate trainees at all different levels of their training. I get to train and educate my colleagues and other personnel, other medical professionals at different hospitals. And then I have kind of my online advocacy and public education that I do. And so all of that really kind of contributes to my job as a whole. So when it comes to the emergency department, I like a chaotic environment. I enjoy the fast go pace. I enjoy puzzles and I enjoy getting my hands quote unquote dirty, but in the sense I like to get my hands involved. But I think one of the biggest things that I love about my job is that it's a team-based environment. I love working with lots of different people. I love educating. I love being educated. And it also is the constant ebb and flow of learning and growing as a physician. You learn every single day, and if you don't, I always tell my younger trainees, you should be able to walk away from a day in the ER and tell yourself about one thing that you learned that's new. And if you don't, then that's probably when you should stop going into medicine, because it's a constant learning environment. And so the best thing you can do for yourself is walk away from a shift saying, I learned this today, and you take that into the next day. On top of that, along with all my other roles, I think one of the other best things about my job is the people I meet. You know, sometimes we have new trainees coming in all the time. We have new colleagues coming in all the time, new nurses coming in all the time. But I think it's the families. There are some relationships I've built over a long period of time, just because either I saw them a lot in the ER or I've worked with them, you know, through our Sick Kids Foundation and the Sick Kids Versus campaign. And these relationships are unbelievable. I love them. I love hearing from them. And in fact, I truly have to say that some of the cases I've seen in the past, some of those families still keep in touch with me. And it's a friendly reminder about what we do every single day is appreciated and recognized, but it also makes you feel like you're doing the right thing and you're in the right job. So I think it's a multi-part question. And I hope that definitely kind of covers a little bit about everything. The next question is, what is the most challenging part of your job? That's a hard one, because when you think about the ER, you think about lots of things constantly going on at the same time, and that can be challenging from a human perspective, from the brain perspective and the brain capacity perspective. But I think as ER physicians, we go into that job knowing that, and we love to do that, and we find ways to manage that. I think the hardest part and most challenging part of the job is the days where we experience humanity at its most vulnerable times. And that could be a positive because you can learn from it. But I'm talking about the days where you see fear and anger and anxiety and sadness. And you could possibly see that all in one shift. And that's not just from the families. That's from your colleagues, everyone working together. Some days are really, really rough. And I think remembering that we're human and not just physicians or medical professionals can be hard for people sometimes. You know, we're people sometimes think of us up here and put us on a pedestal, but you know, we're still human and we still have emotions and we still get affected. And so some days can be so hectic, and being part of the process where you have to deliver bad news or you have to tell a parent, no matter what we did, everything we did still didn't work, you know, and we couldn't save your child. That lives with you forever. And you at that moment is, you can either leave that at where it happened and leave it at the front door, as we call it, and never go back to that moment, or you can take that moment and you can turn it into a positive and as hard as it might seem, and say, how can I learn from that situation? How can I learn to be a better physician? And it's not about blame or guilt or you did something wrong. It's about that moment of connection with other humans and delivering that news, and how do you continue on from that? Because a lot of us do take that home with us, even if we don't want to. And I have to say that over the years, those challenges and those moments have never left me. And I can definitely say that I remember the really, really highs. So going back to what's the best part of my job, and the really, really lows. And I use an example, especially for mentorship and young adults who are looking potentially to go into medicine. Even in some of those worst days that I've had, and some of the worst cases I've had parents thank me. And I think that says a lot about our ability to connect with other humans, even at our worst times. So I hope that answers the part about the most challenging. So let's go into the next question. How were you able to pursue a career in medicine amidst your other interests? This is a challenging question, because I think this can be applied to all jobs. But I think the thing about medicine is you need to realize when you get into medicine, this is a lifelong commitment, and it's a lifelong learning journey. It never stops. So it's not like, once you hit the mark of becoming a physician in whatever area of interest you have, it stops right there. It's not just about showing up to work. There's an expectation to educate. There's an expectation to take part in certain other activities and things like research. There's also, expectations to present at conferences. And on top of that, it's what else do you want to do? So once you want to get into medicine, you set yourself up to ensure you get there. And what I mean by that is, like, your life will slowly start to change to accommodate the longer studying hours, the exams you need to take, the interviews when it gets to that point. And then you finally get into medicine, and it becomes like, now you're in medical school, and you realize that you go into medicine for the purpose of either you have a passion about anatomy, biology, human disease, or just you want to help humans. It sounds very cliche, but this actually is a great foundation, because that's really what you're doing for the rest of your life, regardless of which stream of medicine you want to get into. And then when you stop and you think, these are human lives that you are going to be affecting and dealing with and making decisions with for the rest of your life, you pause, stop, and think. You don't want to make mistakes, although let's be realistic, you're going to make mistakes, you're human. But when you put that simply, studying becomes more interesting because you tie it to an end goal. You tie it to, this could affect someone's life, and I don't want to make a mistake, because none of us go into medicine to want to make mistakes, but we have to realize that we're going to. And we hope that those mistakes are not severe, but there's always that potential that that's going to happen. And recognizing that and recognizing our limitations as well is super important, and makes you almost superhuman in that way, and being very vulnerable and very transparent. And so when you realize that, studying becomes fun, studying becomes interesting, studying becomes, it's a daily thing. And that's your life. That's your lifelong passion, and that's your lifelong goal, and that's going to be who you are. So once you take that and realize that, then you go, okay, well, what are my other interests? For me, I like space. We just went to NASA, and I'm a nerd. I like Marvel movies. I like comics. I like hiking and traveling and learning about different cultures and cooking and spending time with my friends and family. And it's up to you to recognize that sometimes those are things need to be put on pause, and that it's also important for you to make time for those things. And it does take time to find that balance, work-life balance. And I think that's fascinating, because I think there was a question about work-life balance. So let me just check, because we can just kind of go right into that question. the question actually was, what is the best piece of advice for a student in high school who wants to pursue medicine but is worried about the work-life balance? And what I can say to that is, I will always be honest, but the work-life balance paradigm exists and will always be a concern no matter what profession you go into. But I will say, the question before, let me scroll back up. Question before had to do with pursuing a career in medicine amidst my other interests. And I think it ties very politely into that because I put a pause on some of my other interests to make room for medicine, because medicine is going to be the rest of my life. And some of those interests I could still do in smaller amounts with less time. And when it comes to, making sure that balance happens, it's an active choice. And I wish someone had told me that at a younger age. I wish someone had told me, everyone's going to push you to work harder and continue to focus and don't lose focus. But don't lose focus doesn't mean you can't balance it out with an hour of workout today or tomorrow, or that 1 hour hike, or that trip to, somewhere you've always wanted to visit for 2 hours. It's okay to let yourself have that time. Just because you missed out 2 hours of studying doesn't mean you're going to be 2 hours behind your colleagues. And I didn't really get taught that or mentored through that part. I just thought that the more I studied, the more time I spent, the better I was going to be. And the reality of it is that it's about effective studying and effective time you put into medicine, and not about more time means better and means you're better in your career. So when it comes to finding the work-life balance, I think that's just going to be across the board. I don't think that's just medicine, even though it seems that medicine kind of takes away a lot of your interests. But I will also like to say, because the question asked about for a student in high school, and I wish someone told me this as well, was what you do in high school maybe affects your foundation in terms of your ability to focus and study and develop good studying skills. And, high school may teach you how to be involved in other extracurricular activities and multitask, but enjoy your high school years. Don't make medicine your focus in high school, because when you get to university, that's when you need to start setting yourself up for success. No one looks at your high school years when you go and apply to medical school, no matter what anyone tells you, because there's only so much you can put on a CV when you apply to med school, and there's only so much you can tell them when you interview for medical school. So the reality is knowing now long term and knowing that you're going to need a better work-life balance when you get into medicine, enjoy the time now in high school. Don't let extra pressures get on your plate. Study for your test, do your test, show up for those extracurricular activities. I played every sport in high school. I played basketball, baseball. I was a competitive swimmer on a national level, and a provincial level. And then I also did that for high school. I got involved in student council, and I still managed to make my grades, but I realized I probably could have spent less time just focusing on being the best in school and enjoyed a little bit more of the social part of it, because I didn't really enjoy that. And that doesn't mean go like 180 in completely different direction, but just worry about med school and medical school process when you're in your undergrad years. And that's when you need to start setting yourself up for success. And that also includes starting to find mentors, which I really love about this Q&A, because it all came out from mentorship. And so I do a lot of mentorship on the side, and it's built some really, really good relationships. Okay, next question. What made pursuing a medical career the right choice for you? This might sound a little bit cliche, but I think, so I was told by my parents, I apparently really was interested at a really young age, and I used to say I was going to be a doctor at a really young age. And I didn't know exactly what I wanted to do in medicine, but I knew I wanted to work with people. I really did have always an interest in pediatrics, kids. I really enjoyed sciences as a kid. I was always very curious. My nickname when I was younger was ne touche pas in French, which means do not touch. And that's because my hands were constantly going, needing to build and break down and explore, and things that gross people out didn't gross me out. So as I got older, I just realized that putting all those things together and those interests together, I knew I wanted to deal with humans. I really needed to deal with breaking things down and understanding what they were at the organic cellular level. That doesn't mean I really liked organic sciences and chemistry, but those are some of the challenges you got to get through to get to med school. And I love the human body and disease process. So a little bit about my career path is when I first started, I really, really wanted to be a cardiothoracic surgeon. And the reason for that was because my brother was a congenital heart baby who thankfully was saved and had major operations at hospital for sick children, which is kind of my motivating story as to why sick kids was my dream job and why I'm honored to be there right now. And so for me, it was I want to do cardiothoracic surgery. So that was at a very young age. And then as I went through medical school, things changed. I knew I still wanted to deal with children. And then I knew I wanted to have something to do with like my hands-on. And I wanted, weirdly to say this, but it is weird to say it, but I really wanted to deal with really sick children. And so when you put all those pieces together and the fact that I need to be constantly busy, because in a weird way, I do get bored, and that's recognizing my own characteristics, my own personality. I do better when I have a lot of things that are happening at once, or a lot of things happening where I just schedule myself, which, by the way, still means scheduling a work-life balance and a lot of fun things that I love to do. But yeah, so that's kind of how my path happened. Now, this might not be the same for everyone. There are some that I met in my medical school career, especially in medical school, who actually medicine was their second job. They realized that later on that this is something they wanted to do. So when I answer the question, what made pursuing a medical career the right choice for you, I was one of those people that realized some of the things that I loved and some things I loved to do really just transpired into a career in medicine, along with my determination and my ability to not listen to everyone saying that you may not make it, you may not be able to succeed in this. This is a long haul. You're going to make a lot of sacrifices, which we'll get to. And so at that point, I still pursued it and I still loved it. And there's some good days and there's some bad days, as we talked about challenges and positive things. But the thing is you may not realize that right away. You may right now be interested, then lose interest. And then all of a sudden in 20 years from now, you may decide that medicine is for you again. And all I can say is if you think it's for you, do it. You're never too old to get into medicine, especially if you're doing it for the right reasons. And I feel like some people that I met in my career and my journey, if you were entering medicine that late, you weren't doing it for anything but interest and because you really wanted to do it. And I found those were the people who just worked hardest and worked the best, and they just loved what they did. So please know that, you may not know right away, and that is okay. And then the other part of it for me was I did so many different layers. So I did medical school, then residency, and then fellowship, which is a subspecialty. So I did residency in pediatrics, and then I did subspecialty in pediatric emergency medicine. And then I did a further subspecialty or fellowship in robotics, aka simulation, in pediatric emergency medicine. And when I looked at a medical career, I also always said I wasn't going to really... the way I put it is there was three things in my life that needed to be consistent when I chose the final path. So what I ended up wanting to do, which is a pediatric emergency medicine. And if you keep focused on the things that are most important to you, you can find a career in medicine or medical professional that fits that. And for me, it was, I needed a schedule that was flexible. And so emergency room is scheduled shifts. I wanted a job where I didn't have to go home and worry about being paged or be on call. Now, there is a little stipulation with that in the ER. We have backup calls. But when I go home and I leave my work at work. Now, with all due respect and transparency, on my bad days I talked about, I take that home with me. But I'm not sitting at home doing work. I'm not following up on patient care. I don't have to make phone calls and follow up on lab results. And that was a choice I wanted because I knew I wanted a balance for having time for my family and not bringing that work home and taking away from my family or family building, whichever one it is. And then I wanted somewhere that I worked, so it was about location, where I wasn't too far from my family. When I chose to go into medicine, I sacrificed distance and I traveled very far from my family to do the building of my career. So for my medical school portion, my residency, and my first fellowship. And I had told myself that at the end of this, I need to be close to family. That was the most important thing. And so when I kept those three things at the forefront of my career and career decisions, it worked out, because I knew that if I kept those three things at the front of my mind, I knew I would find the best career that fit all that. And emergency medicine does exactly that. The next question is, why did you want to specialize in pediatric emergency medicine? You guys might find this. It's going to be kind of a summary of everything we've talked about. One, I love working with kids. That was the first thing. Let's talk about the emergency side. I love what I call the ER department is controlled chaos. There's always 1,000 things going on. And by 1,000, obviously I'm over exaggerating, but there's always tons of things going on. And amongst that chaos, I feel the most comfortable. That's just my personality. It may seem very weird for people. And it's the same with trauma. When there's people who would panic, something comes over me. I'm much more calmer and I'm like, let's do this. And I find that that's just, I guess, in my DNA. And so this is why it was a really good fit for me. It's fast-paced. It requires problem solving. It requires multitasking. But the best part is it's a team setting. I love working in a team setting. It's not because I'm the staff that's on, I'm the captain of the ship. No, absolutely, that's not how this works. When you walk into ER, there are multiple people who are involved. And to make that successful, you need to have every single one of those key players, from a charge nurse to the multiple nurses working on the floor, to the clerk that's taking the phone calls and addressing the phone calls, to every trainee that comes in and is training and that you have to educate at that time. Including registration and the people who do blood draws. Like, there's just so many people who are part of that team. And what you'll realize is that some of those highs and those lows are supported through that team mentality. And so it's nice to see in a really high anxiety, high energy moment, a team to come together and successfully work together. And I find that the ER is essentially that for your 8 or 10 or 12-hour shift, whatever it may be. And you can come home really exhausted and feel amazing. And you can come home exhausted and feel you could have done something better. But the good or the bad, the ER is the place for me. And I love every moment of it, no matter the challenges that we talked about earlier on. It's everything, and essentially everything I've ever wanted in a job. And the cherry on top is the parents that I meet and the parents I build relationships with. So ER, for those of you that are very much of my personality, might be a career that you want to look into. So it's next question. Has mentorship played a role in your journey? Oh, yes. So I think I dropped a few little clues throughout the other questions about mentorship. Mentorship was extremely important and key for me. Unfortunately, though, I didn't have early mentorship, as in like individuals who I could really speak to in my like high school years, and not even really in my undergraduate years, partially because I didn't really realize that mentorship was a thing that I needed. So awareness. Also because I also didn't actively seek out. I just said, I want to do medicine. I want to get into medicine. I want to be a physician. And no one really guided me, telling me that setting up mentorship that early on would be super key. So it wasn't until I got into medical school that I realized the importance of mentorship. And it started in medical school, where I built great relationships with 2 of my teachers who were also physicians. And they provided me insight and guidance and what would be the next best steps, instead of me sitting there and like listening to a bunch of people telling me what I shouldn't and should do and how I could be successful and how I can't be successful. And I found that the mentorship helped keep things very controlled, in the sense that I could listen to someone who's been through the process and tell me what the necessary things were to do, or coach me in moments of difficulty based on experience. It wasn't just hypothetical. And so with time, you realize that mentorship not only is key in helping you build the right pathway and career for yourself, but they teach you different communication styles, how to deal with challenges, both with people and with systems. And some of them can write you some of the best letters of recommendation. The key, though, to mentorship, and I don't think many people say this, is that when you pick a mentor, it's got to be purposeful, and it's got to be very much about a mentorship that's going to provide you with the guidance you need. But the other part that no one told me was mentorship is on you. You are seeking a mentor. You are asking someone who is already very busy, who is in a career you might strive to be in, who you want to sponge up their knowledge and their experience. And so it's all about the process of approaching them as a mentor. That's key number one. There is a process to it. There's a polite and professional way to approach mentorship. And it's also about your ability to recognize that it's on you. If you need something, it's you that needs to reach out to the mentor. If you have some interest or a question or you want a goal plan, it's on you to take initiative and do that. Your mentor has done everything already to get to where they are, and they're willing to support you and help you through. But the relationship, although two ways, because mentors do learn from their mentees, at first and early in your career, you need to show you're committed to that mentorship relationship. And I don't think a lot of people talk about that, because I've heard the struggles of mentorship where someone's like, this person's my mentor, but they don't really reach out to me. And the reality is it's because you need to show the initiative. You need to show you're dedicated to that relationship. You need to show that you're willing to go above and beyond, because at the end of the day, you are going to get more out of that mentorship relationship, because it's you that's seeking something. And trust me, some of those mentorships that I had to this day are still some of my colleagues and people I can call friends now, because now we're at that level together where we are both mentors in our own fields, but also we can talk about our relationship and how it's built and grown over the years. So I hope that's very helpful for you all. How can someone get involved in the healthcare field without becoming a medical professional? So I guess this depends on how you define medical professional, right? So if we're just saying medical professional is a term that will equate to being a physician, then there's lots of other ways to get involved in the healthcare field. Let's talk about, even just within my own department, you got everything from nurses who also within themselves have lots of different levels. So you have, RNs, and then you have things like other individuals like NPs, which are nurse practitioners. You can become a social worker. There's child life specialists. But then, you got other individuals who are like IV experts, phlebotomists. And then you have the people who help make sure that the system runs. So that's like our clerks, our registration. So in my own department, those are other ways that you can become involved. I'm sure I'm missing some because I don't know all the different roles. I can say that those are the ones I interact with the most. But then and there's also physician assistants. They are amazing. We have a lot of them in our ER, and we just recently celebrated Physician Assistants Day. So, congratulations to all of the ones that I know and love so very much and get to work with, but as well. And outside of that, there's other areas in what we call healthcare practitioners, healthcare professionals that are not necessarily what we call MD, as in medical, doctors, doctor of medicine or osteopathic medicine. And those are things like massage therapists, physical therapist, occupational therapists, there's chiropractors, psychometrists. So there's all different levels that you can be involved. And again, if that's something that interests you, finding a mentor in that area of interest is going to be super key in making sure that you're successful in knowing how to navigate that career, because not everyone who's a physician knows really how to navigate, how to get into these other streams. Because once you're in the stream of becoming a physician, it's not something where you learn about the other streams necessarily and how to do it. And they're definitely very complex and very demanding. So the key is to find the right mentor for any of those other areas. Oh, last but not least, what does What does a typical day in the life look like for you? So I love this question because it's a lot of fun. So it depends on when my shift starts. We have different shifts. We have something called the 4 a.m. to 10 a.m. shift. Then you have the regular start in the morning, 8 a.m. Or you start mid-afternoon, or you start in the evening, and then you have the overnight. So the hazard shift, we call it. And so no matter the way it starts, for me, I like my drive-in or my subway in. And it gives me time to relax, decompress, think about things, review some of my, I know this sounds really nerdy, but I review some of my pathways and I review some of my critical care stuff like CPR and resuscitation stuff. And I typically get to the hospital, PPE now these days, grab a coffee if I don't already have it. So I say hi to my favorite people at Starbucks. It's the kids, they know me. Walk into the ER and truthfully, I take a look at the board to see how long the longest waits are. That's more now than ever before. And then I mentally prepare myself. So essentially the way it looks like for an ER physician, you come in and you take what we call a handover from another doctor who was just on. And the ER is split into two different sections. Well, actually multiple sections, but the main section of the ER is two different sections run by two different physicians. And then there is multiple other sections for what we call lower acuity patients. And that's run by multiple other physicians. And then you get introduced to your team for the night. So I will either have a fellow, so someone who's subspecializing in pediatric emergency medicine. I'll have residents either from pediatrics, emergency, family, psychology, anesthesiology, whoever's with me that day. And then I may have some medical students with me that happen to be doing the shift. And I get introduced to my team. I take handover. And probably by then, even if it's the first 30 minutes of the shift, I've probably received 2 or 3 other calls from other hospitals asking to transfer a patient or needing help with a patient. I've probably had 2 or 3 nurses already ask about the patients that we still haven't heard about, or what can we do next? Or at this point, bells have started ringing because someone is really, really sick or got sick while being in the ER, or an unexpected trauma or resuscitation has come in. And that's just the first 30 minutes of our shift. And that's not all the time, but that's what an ER shift can look like. But it does happen quite a bit, especially a lot of the different phone calls and requests and questions while you're also trying to learn about the patient that you still need to take over and manage in the next few minutes. And so that's just the first little bit. And then take that and multiply it for about 8 to 10 hours. And in between there, you are literally getting pulled in 20 different directions at one time, but it all comes together at the end of the day. Trusting yourself, trusting the people around you, trusting your nurses, trusting your team. And amongst all that, what you're still trying to do is balance the teaching of younger, newer physicians. So I think that's one of the other big things that I love, and I didn't think I mentioned that, is I know I'm educating future doctors. So when I educate, it's done very, very, very seriously, because I know what I'm teaching a medical student, a resident, and a fellow is potentially going to affect their management of a patient in the future. And so it's not just flimsy and very off the cuff, it's purposeful. And we try to make time for that regardless of how busy things are. And there's a way to do it. You bring someone to the bedside and you teach, or you teach very quickly based on something you heard a discussion over. And it's not always very easy, but at the end of the day, it's always very satisfying. And so when you take all those moving pieces and you do that for 8, 9, 10 hours, you can imagine how exhausting it is. And I will say that during COVID, it's been a little different and harder because there's been so many changes in the way the typical day looks. But the standard same themes apply every day. Controlled chaos, teamwork, learning about yourself and walking away every day saying, what did I learn today that's new and how can I apply that in the future? Learning new communication skills, being an educator and teaching. And for me, the other part is educating families as best as we can, especially in a really quick-paced environment, and taking the highs with the lows in seeing humanity at a completely different level than people see humanity every single day. So that's what a typical day looks like for me. I think I've answered all the questions. I'm looking, let me see. I do. I think I've answered all your questions. I hope my answers, resonated with you all. I hope they helped. I hope they provided some guidance. I hope that some of you that are watching this will be considering a profession in medicine, whatever way that looks. And I really hope that this brought a different perspective of what it's like to be a physician. And being a physician doesn't mean giving up everything else that you love. It's about making a conscientious effort to still balance the things that you love, but while understanding that while you get to that process and while you get to that end point, be prepared to sacrifice a lot. You're going to miss out on a lot, sadly, but it's worth it. And those that love you and know you will understand that, and they will be the ones that at the end of the day, at that end of that finish line, they're going to be the ones still there cheering you on. And that's okay. It's okay, because this process isn't for everyone. But when you do complete it, there is a sense of accomplishment and a sense of relief, and you will never find a better profession for yourself if this is what you've committed to. So I wish everyone the best of luck. I hope that in the future I do meet some of you if this is your profession of interest. And I look forward to, if there are any other future questions, to receive those questions, and happy to answer them. So wishing everyone a wonderful day, evening, whatever time this is posted at. And I thank you, and I'm honored for the time to be able to answer all your questions. Bye for now.